Welcome to the Health Information Management Services section of the new employee provider orientation. This presentation will give you a general overview of your responsibilities related to medical records completion, information about the Message Center, helpful hints, and individuals in the HIMSS department to contact for questions or concerns. Your key contacts in HIMSS are the director, Kathleen Grillo, the manager, Kelly Hovanchik, and the analyst, Nancy Riffenacht. Their phone numbers are on the screen, and each of these individuals have confidential voicemail. The HIMSS office is staffed Monday through Friday from 6 a.m. to 6 p.m. and on Sunday from 7 a.m. to 3:30 p.m. Should you wish to visit the HIMSS office for any reason, it's on the third floor of the center building. History and physical reports for inpatient admissions must be completed within 24 hours of admission. If you are a surgeon, your operative reports should be dictated as soon as possible after the surgery. In the meantime, a post-operative progress note must be completed and placed on the patient chart. The post-op progress note is a green form and is available in the surgery department. Discharge summaries must be dictated at the time of discharge. HIMSS picks up the paper patient record at 7 a.m. in the morning following discharge. So, if you are a provider who likes to use the paper record to dictate your summary, you must do this on the day of discharge. HIMSS scans all paper documents into the EMR by 2 p.m. the following day. Telephone and verbal orders are entered electronically and must be signed within 48 hours of the order. They are available in your Message Center under the Orders tab. Message Center is the application used in the EMR to review and sign your dictated reports. All inpatient, emergency department, unless you are using dynamic documentation, and ambulatory surgery encounter dictations will populate Message Center, along with outpatient cardiology, wound care center, breast care center, sleep disorders laboratory, and women's health center. Documents to sign will display in a list that looks similar to an email box with the most recent dictations listed first. Documents in the Message Center will be in preliminary status, and at the same time as they populate Message Center, they will also populate the EMR so that they are available for patient care. Double-clicking on the patient name will open the transcribed document for your review and revision. You have the ability to edit the documents prior to signing. Edits you make on the document in Message Center will transfer to the document in the EMR. Once the report is signed, the status will update from preliminary to final. Most departments will train or arrange for Message Center training. However, if you have any Message Center questions or concerns or would like to schedule training, please contact Nancy Riffenacht, the HIMSS analyst, at 798-5106. Keeping up to date with your deficiencies in Message Center is the best way to avoid record completion problems later on. Medical records are required to be completed no later than 30 days after discharge. However, it is expected that they be completed sooner. For providers who come from a distance, the ability to remote access LORDS EMR is available for dictation and chart completion. Remote access is generally arranged for you when you get access to all of the other LORDS systems you utilize to provide patient care. If, for some reason, you need remote access and did not get it, contact your office manager. Incomplete medical records begin the aging process at discharge from inpatient, medical observation, ambulatory surgery, and emergency room encounters. HIMSS will send a series of weekly letters based on aging to remind providers to complete their records. The final reminder letter is a certified letter from the CEO sent when an incomplete record reaches 30 days in age. This letter is followed by suspension if the records are not completed within a specified time frame. Completing your records and record deficiencies in a timely manner is the very best way to avoid the reminder letters altogether. Here are some helpful hints that will make record completion a little easier for you. When you begin your work at Lourdes, bring your laptop with you to make sure you can remote access the EMR. If you are having difficulty, contact the Information Technology Help Desk at 798-5687 to arrange to have the EMR loaded onto your laptop. Be sure to request a ticket with the help desk. This will ensure that someone will be assigned to help you. Make an effort to access your message center on a regular basis to sign dictations and orders, and to dictate any outstanding reports. If you are going on vacation, contact the HIMSS department at 798-5264 and give them the dates you will be away. Your records will be put on hold and will not age while you are away. We ask, however, that you try to complete your records prior to leaving for vacation. This completes the Health Information Management Services new provider orientation. Welcome to Lourdes. The HIMSS department is here to assist you with any questions or concerns related to medical records. Please do not hesitate to contact us. That's okay.